Good morning, everyone. I hope you can hear us clearly. I do want to start by thanking you for joining us for this Medical Research Future Fund Strategy and Priorities consultation. I'm Natasha Plungers. I'm the CEO of the Health and Medical Research Office. I would like to start by acknowledging the traditional owners on whose land we meet today. For me, I'm on the lands of the Ngunnawal and Ngambri people. I pay my respects to their elders past and present. And I also want to extend that acknowledgement across country as well. And also welcome and pay respects to all Aboriginal and Torres Strait Islander people who are joining us this morning as well. I'm very pleased that we're able to get together for this consultation webinar. I will let you know that we not only is this live, but we are also recording this webinar as well. Now, what I'll do is not hold you up any further. There'll be plenty of opportunity for us to have a chat and also for opportunities for questions and answers later. I will now pass you over to Professor Catherine North. Thanks, Catherine.
Good morning, everyone. If I could have the next slide, please. Okay, so this is an overview of what we're going to cover in the webinar. First of all, just to give you a context around the Australian Medical Research Advisory Board and its purpose and the context of the Medical Research Future Fund, and why at this particular time, well, we've been doing a number of strategies over the last couple of years, why the strategy and the priorities are being updated. We're also going to get some insight from the Leon from the Health and Medical Research Office on the evidence-based development of the strategy and priorities, and including looking at a national and international landscape analysis. I'll then go through the draft priorities and the strategic objectives, and we'll give you the consultation approach and next steps. Next. So there's been a new refresh of MRFF, all starting this year, and this was, you can see the members of MRFF, and my Deputy Chair, Ken Smith, is also on the call. And we meet regularly, and this is actually a photo was taken where we have a joint meeting with AMRAB and the NHMRC Council 3 times a year, which is all part of the bringing together the complementarity of the NHMRC and the Medical Research Future Fund, which you will also see coming through as we go through the priorities and the strategy. We also have engaged with international advisors because there's a lot we can learn, particularly from our UK and Canada colleagues. And Ken and I had a great meeting again around the strategy and priorities last week with Lucy Chappell, who leads the Biomedical Research Translation Centres program within the UK, and Tammy Clifford, who works with CIHR. Next. So the MRFF Act was established to AMRAB, and this is just highlighting for you the legislation under which AMRAB sits, and it stresses that we need to refresh the overall strategy for the Medical Research Future Fund every 5 years, and the priorities every 2 years. And the goal of this was to make sure that the strategy and priorities were up to date and reflecting changes in terms of health needs and where greater strategic investment should be made. So this is all about making sure that the investments on what is really a top-down and priority-driven fund are responding appropriately to the needs across our health system. Next. So just the definitions, and it's what you will see is there's a lot of overlap between the strategy and the priorities, and that is by design, because the overarching strategy is around long-term direction. It's very high level. It's not delving into specific areas of focus. The priorities are really what we've identified as game changers, where which are priority for investment, and these are updated every 2 years. Specific priorities obviously can continue over a number of successive periods, but this happens actually once every 10 years, where we're looking at the update of the strategy and the priorities at the same time. The other important thing is that these high-level strategy and priorities are taken into account in terms of the funding decisions made as part of the Medical Research Future Fund, but also in the evaluation that happens on a 5-yearly basis to make sure that the MRFF is fulfilling that overarching strategy. And so that's why getting it right and getting the focus right at a high level is incredibly important. Next. So the current, as I've said, the current strategy and priorities expire in November, and hence the timing of this particular piece of work and consultation. And I know that all of you have been involved in the consultations around the National Health and Medical Research Strategy. And these strategy and priorities sit beside that. But what it's given us an opportunity is to also make sure that as we're thinking about expenditure from the Medical Research Future Fund going into the future, that we're really aligning with all the strategy work that's been going on across different parts of government, including the ambitious Australia consultation and strategy as well. So this update then, which will guide the investment decisions of the Medical Research Future Fund, it gives us an opportunity to respond to evolving health system needs, make sure that we're on the front foot in terms of research and technological developments. And as we can see with, for example, the speed in the changes of AI, really reassessing what we're doing in that area is particularly important on a very regular basis. The goal of the Medical Research Future Fund is very much on translation and impact and the health system sustainability. And what going through this process does is make sure we're responsive and aligned with national priorities. But as I said, at this point in time, it's also been a great opportunity to make sure that the MRFF was aligned with the National Health and Medical Research Strategy and with the strategy of the NH and MRC. Next. So the initial development of the strategy has been informed by a whole range of work done by the Health and Medical Research Office to look at the broader national and international research and funding landscape. And this has been incredibly helpful because by looking at the strategy of our counterparts overseas, as well as looking at our own internal priorities, it's making sure that what we are doing here is aligned with international best practice. And I'll now hand over to Leon, who will go through the initial development and evidence-based approach. Over to you, Leon.
Thank you, Catherine. Hello, everyone. I'm Leon Teo, Acting Director of the Research Advisory Section at the Health and Medical Research, which is responsible for the implementation of the Medical Research Future Fund, or the MRFF. Now, to support AMRAP in developing the new MRFF strategy and priorities, my team performed a landscape analysis that looked closely at how MRFF investment aligns with the 3 sets of MRFF priorities that sits under the current MRFF strategy. This analysis helped us understand how research funded by the MRFF fits under the strategic direction that was laid out by the current strategy and priorities. As part of this analysis, we also benchmark MRFF investment and research priorities against those of national as well as international funders. And this gives us valuable context about our performance and strategic positioning relative to our comparative funders. So domestically, we selected the NHMRC, or National Health and Medical Research Council, as our comparator. And internationally, we benchmark MRFF investment against the Canadian Institute for Health Research, or CIHR, and the United Kingdom's National Institutes for Health and Care Research, or NIHR. Now, these funders were chosen due to our similarities in research priorities and research funding strategies, as well as overall national health systems, acknowledging there are differences in governance. Additionally, we performed 2 case studies on funding complementarity across 2 national funder pairs to identify any key learnings that we can take away to increase complementarity across MRFF and NHMRC research funding activities. Now, across this next few slides, I'll be sharing some of the highlights with you. So as part of the analysis, we aligned every grant that was awarded under the current strategy to their best fit MRFF priorities. This result can be visualized in this chart over on your left. Here we see that consumer-driven research, priority populations, and effective and high-value care are the top 3 priorities with the most MRFF investment. We can also identify priorities which did not receive as much MRFF investment over the past 6 years, and this includes primary care research, health impacts from environmental factors, and drug repurposing, which respectively accounts for under 10% of total MRFF investment. Again, this is under the current strategy. This alignment also allows us to benchmark the type of research that the MRFF has funded against our comparative research funder. A good example is the chart on your right. It's the percentage of total funding that was invested into clinical trials, which sits at about 31%, or 660 million for the MRFF, and is in a strong competitive position among our comparative funders. This analysis really also allowed us to assess complementarity of MRFF funded research with those of NHMRC across the national funding landscape. As an example, this is the an example of this is the larger proportion of MRFF investment in research involving implementation of interventions within the health system, which really speaks to the role that the MRFF play in funding health and medical research and innovation in the later stages of the research pipeline. This is complemented by the higher investment that the NHMRC that is aligned with the capacity and capability building for researchers. This covers direct support for researchers, largely through the NHMRC's highly successful investigator grant scheme. This speaks to the role that the MRFF plays in this space, complementing NHMRC's direct support for researchers by focusing our investment in building researchers' capability through collaborative and multidisciplinary research programs. So more broadly, we also benchmark our funded priorities internationally. In this example here, we can see that MRFF investment in research that is aligned with the priorities of consumer-driven research and translation and commercialization benchmark ahead of Canada's CIHR, but is less comprehensive when compared to UK's NIHR. And to see why that is, we looked at the research priorities that was published by these funders to see what we can learn from their investment strategies. So a quick summary of our findings are captured here in this slide. So first, our international comparators, in particular NIHR, prioritizes knowledge translation, implementation sciences, as well as evaluation. The second, a system level focus to research program, which increases national coordination and translation outputs. And third, building in strategic complementarity with other funders, either national or philanthropic or etc., to provide better coordination at a national level to reduce duplication. In doing this priority alignment, we also identify key gaps and differences with our own priorities. For example, our international comparators puts a strong emphasis on equity and consumer involvement, framing them as cross-cutting principles across the majority of their funding programs. AI or artificial intelligence was highlighted consistently as a key capability enabler, with the NHMRC in particular emphasizing the ethics, safety, and equitable use of AI in research. And finally, a key reason why the NHR was able to achieve such high funding saturation in the priority associated with translation and commercialization, as well as consumer-driven research, was down to their emphasis on long-term system-wide research, embedding research into the health system, and focusing on national coordination of research programs and activities. Now, all of the above really created an environment where research can be embedded at the interface between consumers and the health systems to increase the efficiency of evidence gathering, analysis, and translation at a national level. Now, these findings, among others, were presented to AMRAP as part of the evidence base to support the development of the new draft MRFF Strategy and Priorities. Thank you for the opportunity to share this information with you. Catherine, I will now hand back to you, and Catherine will take you through the rest of the presentation. Thank you.
Great, thanks very much, Leon. And I think you'll see that those learnings and the observations coming in from our international colleagues has also been incorporated in the design of the new strategy and priorities. So one of the key themes emerging from this work is the value of more outcomes-focused approach to priority setting. So rather than trying to cover everything, we think that there'll be a benefit for having fewer, more targeted priorities that provide a clearer direction for the investment through the MRFF. We're also considering how to create greater continuity across successive MRFF priorities so that individual funding opportunities are contributing to longer term and more strategic vision rather than a series of disconnected initiatives. And I think that has been a criticism of the MRFF in the past, and that there's a real opportunity, and particularly with looking at the complementarity of the NHMRC and the MRFF investments, we can really think much longer term and making whole of systems changes. So in terms of developing these new strategy and priorities, we took that international landscape analysis into consideration. But we also reviewed the National Health and Medical Research Strategy, which came out, was released during the time we were developing these draft strategy and priorities. We also took into account the strategic examination of research and development final report, the Ambitious Australia report. And we also took into account past consultations that went into the National Health and Medical Research Strategy and also the development of the MRFF priorities. So I think that this has really led to what we want to be an outcomes-based approach with continuity across MRFF funding and complementarity and alignment with the NHMRC to support the research from the discovery right through to translation and implementation. And I think we have a real opportunity now by looking at the NHMRC funding and the MRFF funding in continuity to be really taking that alignment across the whole system. And it's also going to give us, I think, a great opportunity to use our funding more efficiently and more wisely. Next. So based on all of that, we have a number of cross-cutting principles that are defined in more detail in the consultation paper. But basically at a high level, and none of these will be any surprise, is really in terms of improving translation and the impact of research. So very much aiming that the research that we're doing that is funded through MRFF is making a difference on the ground. Prevention and early intervention, and it's very interesting in our discussions with our colleagues from Canada and the UK, everyone agrees that actually putting prevention into practice is very hard, because we're really looking at very long-term outcomes. And so that, I think, is we've marked that as a point where we can continue to learn from each other around what works and what doesn't. But importantly, it also needs to include co-design with the voices of the people that are most affected. And again, bringing a level of equity into the decisions around MRFF funded research. The MRFF provides a real opportunity to take a systems-based approach. So we're very interested in how we're building sustainable national networks, whole of country collaboration, and how we can drive that through investment, but also leveraging investment through partnerships. And it's the partnerships and co-investment part of this that I think is a great opportunity, so that we're making sure that we're partnering with our state governments, with philanthropic organisations, where appropriate with industry, to increase co-investment in major research projects. Equity, as we talked about, as Leon talked about, promoting equity across the health system, but particularly in regional and remote communities, is very important. And I think there's a real opportunity to do that with the major advances in digital health and AI. But making sure that there is sustained consumer and community involvement, not just in the design, but in the delivery and improvements in health services, in partnership across that entire spectrum. Next. So now we get to the meaty bit, and I just want to note for all of you, we'll be doing questions by Q&A. So as your questions come up, please type them in the Q&A, and we will get to as many as we can on the webinar, but we can also provide written responses as well. So these are the draft strategic objectives. And remember, the strategy is setting the direction of the Medical Research Future Fund, and these are overarching over a 5-year period. So they're, by necessity and by intent, very high level and very broad. The first is a research-rich and data-enabled learning health system. How do we really make sure that we are embedding evidence within our health system in the spirit of a continuing quality, efficiency, cultural safety and equity? We recognise the great importance of end-to-end translation of discoveries and innovation within Australia. We know that we perform very badly in terms of taking discoveries through to impact, but also being able to, where appropriately, commercialise and build industry within Australia. So that building of sovereign capability, that has really been a big highlight across the National Health and Medical Research Strategy and the Ambitious Australia report. But delivering as well measurable health and economic benefits. The third is at a sector level, positioning ourselves to understand and respond to a wide range of determinants of health and well-being. And this is particularly focused when taking into account the chronic burden of disease, what is causing some of our greatest disease burden, and how we can learn to intervene early or with prevention and at scale. But this also includes emerging and future challenges in climate and environmental change. The next is recognising the transformation of healthcare that is happening and will continue to happen through AI and digital health advances. But it also presents to us a great opportunity in terms of preventative health, diagnostics and therapeutics across care. We're aiming not just to bridge the gap, but we're aiming for a thriving health and wellbeing of Aboriginal and Torres Strait Islanders people through research that's community governed and directed. And most importantly, and you're going to see workforce in both the strategic objectives and the priorities, because we recognise that a skilled, sustainable, inclusive and future-ready health and medical research workforce is essential to accelerate what we want to do in the future in terms of innovation and our capability. Next. So we then took into account all the information that we looked at internationally, but also thinking about where are specific areas where we wanted to have a greater focus and to prioritise. And these are our draft priorities. And these are areas where the shorter term investments from the MRFF will be made and to guide the grant calls. So there's a breadth of priorities, and again, some of them are quite broad, but I'll highlight a few areas. From the AI perspective, we really need to look at everyone's doing something in AI at the moment, as you know, but to really look at a nationally coordinated approach to this across both research and health. How do we as a country take advantage of the major changes that are happening through the application of AI? And how can we keep everyone informed and bring everyone along? We differentiated this from really looking at integrated digital health systems, but really this is the other area where there are major changes from a technology perspective in directly delivering healthcare. And so we're looking at research-informed, person-centred and data-driven digital health capabilities. This is going to be particularly important when we're looking at prevention and early intervention. And but we also need to make sure that we're able to create interoperable systems within our healthcare system, so that these things aren't sitting outside but are embedded within our healthcare system. Again, stressing the importance of Aboriginal and Torres Strait Islander community governed and directed research. And also a very big focus on capacity building to support thriving Aboriginal and Torres Strait Islander health and wellbeing. The next is advanced therapeutics and emerging technologies. And this is again looking at what is being developed within the country and to increase our, the ability to accelerate translation and commercialisation on the ground within Australia, but how we can be innovative and how we can make sure it benefits our people, but also economically, how do we support a vibrant commercialisation and industry partnerships. Climate change is certainly a recurrent theme, particularly as we looked at what was happening internationally. And we need to be, and we recognise we need to be prepared for and responsive to the health impacts of environmental factors, including climate change. We also need to understand that the effects of climate change to be able to actually implement meaningful change. Multi-omics informed healthcare is a real continuum there, recognising that it's not just genomics informing the basis of both rare and common disorders and therapeutics, particularly in the area of cancers. Increasingly, we're using multi-omics as defined by transcriptomics, proteomics, metabolomics, that this is really being used now to accelerate the development of precision therapeutics, but also preventative strategies and early intervention. And again, it's really looking at how overall we've got to have that combination of looking at the genetic basis of disease as well as the influence on environment and social determinants of health. which is the next draft priority, looking at evidence-informed and equity-driven health research that addresses the determinants of health and wellbeing. And these are broad, including structural, social and environmental determinants, and again, addressing areas of high chronic disease burden. Though specifically, we're not specifically mentioning specific disease areas because the list would be very long. It's keeping this at a high level that can be responsive. Embedding research in the health system fits with that, the learning health system strategy area, but making sure that we're continually driving care and prevention based on evidence. So evidence-informed policy, but evidence-informed healthcare. And finally, and again, and I'm sure this will appear in the next round of priorities, a skilled and sustainable health and medical research workforce that is strengthening our research translation, implementation and innovation. And I think it's very important that we're really looking at career paths across, where they've traditionally been funded through NHMRC investigator grants, where we all know there's been very low, the success rate's becoming very low, but looking at being able to fund across the continuum, across the NHMRC and the MRFF in terms of supporting workforce from discovery right through into translation. Next. So I'll hand back, I think it's to Bridget, is this correct? Or Natasha?
I'm happy to take this one forward.
Excellent.
Thanks, Catherine. So as Catherine had noted earlier, the National Health and Medical Research Strategy, of course, had been published, and it is only a couple of months ago now, but it had been published while AMRAB was commencing its work on the MRFF strategy and priorities. So when that development was really sort of kicking off. And what that does is provide a really important opportunity to make sure that there is that real connection and complementarity between those two pieces. So the MRFF, however, of course, does play a very distinct and important role when it comes to Australian health and medical research and within that ecosystem. And it supports very much that sort of priority-driven strategic investment that is really looking to try and accelerate translation, address current and emerging health needs as well, and also complements that broader research funding across the system too. So as Catherine had said, certainly AMRAB has really been considering the national strategy, including the National Health and Medical Research Strategy's vision for Australia to be the healthiest nation, driven by research and innovation and delivering for all. And considering that in the context of both the development of the MRFF strategy and the MRFF priorities as well. Unsurprisingly, in some ways, there is considerable complementarity across those things and real connection and alignment. Now, with the table that you are seeing on screen at the moment, this is trying to demonstrate that complementarity for you. Now, at the bottom of the slide, you will see the National Health and Medical Research Strategy focus areas, so the 5 focus areas. In short, those focus areas are about strengthening the research system, accelerating Aboriginal and Torres Strait Islander-led research and translation, delivering high-value care, driving research development and commercialisation, and also maximising the benefits of advanced technologies as well. So those 5 National Health and Medical Research Strategy focus areas have then been, of course, mapped against MRFF priorities, or those MRFF draft priorities in particular, to be able to give you a sense of how they work together. Now, I guess in some ways I see that this mapping is really showing some of those primary connections and that primary sort of complementarity. It does not mean that there is a lack of complementarity with some of those other focus areas and those priorities, but it may not be necessarily be that sort of the strongest or the greatest connection between them. I guess for me, one example of that would be when it comes to focus area 2 as an example. So focus area 2, I would also see focus area 2 as always also being, which I should just recap. Focus area 2 is about accelerating Aboriginal and Torres Strait Islander-led research and its translation. I would also see that as having a connection with that MRFF priority on the bottom row, which is about skilled and sustainable health and medical research workforce. So there are connections, there are indeed connections throughout those focus areas and the priorities. But this table is really trying to demonstrate where there are some of those very strong connections and really close complementarity there. Next slide, please. Excellent, thank you. So the consultation approach in particular. So this is really about AMRAB undertaking the consultation which addresses the MRFF Act, so our legislated obligations are met, and it really does fully align with those obligations. So we are employing a mixed method approach when it comes to this consultation. That is about us trying to make sure that not only do we reach the widest possible audience as part of this, but it means that we can also really then capture those diverse perspectives and really ensure that there is great input that is captured from across the community. Now, we use that through each stage of this consultation project to make sure that it builds on the previous step or the previous stage. And that helps us to make sure that there's that progressive refinement of the strategy and priorities, and make sure that we're balancing that sort of wide-ranging consultation and input that we're getting, and making sure that it's with targeted technical advice as well throughout that development process. So our open consultation includes an online survey. We do indeed invite you to provide feedback via that online survey, and you can see the QR code just on the right-hand side of that slide at the moment. In addition to that, we are conducting targeted engagement through some roundtable discussions. We have a range of advisory committees that we are also able to not only just tap into, but really rely upon. And certainly for the Medical Research Future Fund in particular, we have joint advisory committees that work with us and the National Health and Medical Research Council. So those committees include the Consumer Advisory Group, also the Indigenous Advisory Group, our Public Health and Health Systems Committee, and also our Industry, Philanthropy and Commercialisation Committee as well. So we are using those opportunities and those direct discussions as well to really enable deep dives into specific issues and opportunities as they come up. The stage process for this really moves from very broad input to having that refined and having it targeted, which allows us to really test ideas before actually focusing in on the areas of greatest need and greatest impact that Catherine had spoken about. Now, the consultation design itself is intended to maximise that participation, as I had mentioned, across the sector, but it's also about trying to balance that with minimising the burden on the contributors. Now, we know that your time and your views are valuable to us, so it really is about trying to get that balance, and also recognising that there had been considerable feedback and information and advice that everyone had really kindly shared during the development of the National Health and Medical Research Strategy as well. So really trying to capitalise as well on that information that had been shared. Now, all of the feedback and insights that are gathered through this process will directly inform the final advice that is provided from AMRAB to the Australian Government, and it will ensure that the recommendations are both evidence-based and really grounded in the realities of the Australian health and medical research landscape as well. Now, with this slide, it gives you a nice, simple example of the time frame and the stages as part of the development. So that open consultation, which is happening now, the targeted engagement going through until early September, and then really that refinement and final advice that will go from AMRAB to the Australian Government. Next slide, please. Now, we will stop now at this point in terms of the conversation and really open it up for questions, but also really to open it up for particular feedback, advice, or information that you might want to share with us. Thank you. And I know the team is at the ready with sharing questions.
Yes, we are. Thank you, Natasha. And thank you all of you for attending. My name is Bridget Simpson. I'm the Head of Strategic Engagement for the Health and Medical Research Office. We just wanted to outline why we have this survey window and this timeframe for consultation. And that is really to ensure that there is sufficient time to consider your feedback today and the feedback provided via the survey in a way that we can utilise that feedback and also meet our statutory process. We have legislative obligations to finalise the strategy and priority before the current framework sunsets. So those submissions from you is incredibly important in helping inform our MRAB on how we tweak and change the draft that has been presented to you today. I'm going to, there's been a lot of great questions. I'm going to just start with one on priority pop.
While the team, I think, might be pulling up some of the questions, I can see that there are quite a few questions and comments that are provided in the Q&A, but the team might read out a couple of questions that have come up in particular.
Yep, I think Bridget's got it. Yeah, that's,
so
yes,
I see there are some comments about making sure that that there may be consideration given to having definitions around advanced therapeutics and emerging technology to really help clarify what would actually be within that. So that is a comment that has been provided rather than a question. So thank you very much for that comment.
I think, Bridget, you're going to share questions with us. Yes.
Yes. The first question I'm going to throw to Natasha, which is, how does the strategy and priorities interact with the missions?
I see that there's also a comment, or a question I should say, which is, will funding be quarantined for rural research? So sorry,
Natasha,
Catherine, you look like you were ready to add.
Yeah. Can you not hear Bridget? Bridget's been fielding questions.
I can't hear you at the moment, Catherine.
Okay, so can you hear me, Bridget?
I can, Catherine.
Excellent.
I can hear you.
Okay.
And I can hear you both.
Excellent. So as long as everyone can hear it, might go to you, Bridget, in terms of just fielding some questions.
No, not a problem. What I'll do is I'll pause that question and we can provide a response in writing to that one.
Yes.
We've had some interest in priority populations and how we looked at the data on priority populations and how they are identified. And there's also been some questions on considering prison populations. So first I was going to turn to Leon if you wanted to give a little bit of information on your analysis, and then Catherine and Ken on how AMRAP are considering who is in a priority population.
Thank you, Bridget. Happy to talk about the data on priority populations. Yes, indeed, we did look in detail at the representation of priority population in MRFF funded research project over the course of this strategy. 44% of MRFF investment, which equates to about 833 million, were awarded to research projects, which had a focus on priority population over the course of this strategy. The top three priority populations in which that received MRFF funding were people in children and adolescents, people in rural, regional, and remote communities, as well as Aboriginal and Torres Strait Islander people. I assure you that this was looked at in detail, and AMRAP received a presentation and information on this to assist their development of the draft strategy and priorities. If you are interested in more data surrounding priority populations, I would suggest or direct you to the MRFF funding statistics dashboard, which is open and available for anyone to look at MRFF investment data. If you did have questions or additional comments on priority populations, I also would encourage you to pop them into the consultation survey questionnaire. So thank you. That's it from me.
Great, thanks, Leon. And certainly we have a very long list of priority populations. I've seen a number of questions sort of have come up, but really what we're looking at is people that where there is issues that are leading to inequity, particularly in access or receiving care, and that have very specific issues. So please, you will see in the consultation paper a list of the priority populations. And if we've missed anything that is important, please let us know. Bridget?
Thank you, Catherine. So there is some questions and comments on the current focus for health systems is on the translation of research, and with an understanding that there may be less capacity for internal funding to be directly involved in research. And sort of some questions on how that translation is shaped. Is it shaped on need, and is it translatable to real world settings? How do the priorities really address the translation and commercialisation of research?
Right, Ken, would you like to take that?
Yes. So, the decisions about funding translation will be dependent upon impact, and that impact will obviously vary across different areas of interest in different studies. But we will align our assessment of that impact on whether it impacts, for example, on priority populations, on large unmet healthcare needs, but also at different levels on the likelihood of impact being commercially successful and useful. So there's a range of different factors that we will take into account when determining how to prioritise translation, but impact on people will be the primary driver of that. Catherine, do you want to add to that?
Yeah, and it's also, I would emphasise there that we're really looking at, as we're designing schemes, we'll be also looking across and working across with the NH and MRC as well. So there is a very stated aim as part of the strategy, both for the National Health and Medical Research Strategy, MRFF and NHMRC, that we're making sure that there is a connect across the system to fund from discovery research through into translation and impact. But a particular focus of the MRFF is really around how do we underpin and bring an evidence base to improve the health and well-being of Australians. And so that is really where the focus is, to make sure that we're funding work that is going to make a difference.
And I must admit, I think that's one of the exciting things about the plans that we're putting in place, is how to link that fundamental discovery so that we ensure that it goes right through to translation and benefit.
Thank you both. So there's been some questions on health systems sustainability and looking at major changes facing Australia. So you've mentioned climate change and the emerging changes in health and medical research as a result. But has there been much consideration from AMRAB on demographic change? So looking at an ageing population, and has that influenced some of the strategy and priorities that you've put forward today?
I think that, well, absolutely. And I would say from the, in terms of aging aging and disability as priority populations, but also focusing, at the other end of the spectrum on geographically more isolated people around regional and rural areas. The goal there is, it's very important that as we think about the expenditure through the MRFF, we're not boiling the ocean, but we're really thinking about where are the areas that we can target and how we can make the greatest difference, whether it's from an aging population or making sure that we're engaging and working with remote communities, with Aboriginal and Torres Strait Islander communities in terms of designing the programs. I think the strategy and priorities are high level. I think that there is a lot of work that then gets done, taking all of these things into account, into designing the specific calls from the Medical Research Future Fund. And they in themselves tend to bring together experts across specific areas to design those calls so that they're fit for purpose. So we could, talk about many different types of population, but I think that we really want to look where there is the greatest need, but also where we can make the greatest difference. Ken, do you have an addition to that? It's a very broad question, and of course we recognise the ageing population, but it's.
I think, yes, just one thing I'd add, it is a broad question, but that allows me a broad answer, is that we're looking at populations of need, but also remembering that those demographic changes impact each other. So, for example, the climate impact is going to be geographically more focused in some areas than others, but we also know that it's focused more on the elderly and the very young. So you get intersections between these demographic and geographic impacts that we need to take into account when targeting our efforts. So we're very aware of those things, and I think they're going to be major drivers of how we focus research.
And I think there was a question, I'll just jump in with this one, Bridget, before handing back to you, is how do we pick the comparator systems in terms of looking particularly at Canada and the UK? And I think there are a number of levels, but first of all, they're very similar. We have very similar nationalised health systems, which really help how we can speed up the translation of research into practice because we have those nationalised systems. But there is also there's similarities and there's differences. Certainly when we're talking to Canada around Indigenous populations, that being able to really compare and make sure we were making, you were really lifting up the strategies and priorities in those areas. But then looking at the other end for where we're grappling to look at, AI, digital health, and how we take that out at a whole of healthcare system level. It's getting it out there is often the implementation and translation is often one of the barriers. And so being able to compare how we're doing that as well, I think it's been very useful, but it's set up a conversation that we will keep having. It wasn't just about have a look once. These are going to be ongoing. Where I think identified a number of areas where we all find challenges where we can work together. Back to you, Bridget.
Thank you. I'm going to throw this question to Leon in HMRO, just to ask, how are you going to measure the success of the strategy and priorities going forward?
That is a brilliant question. Thank you for asking. We at the HMRO have a brilliant team that focuses almost exclusively on evaluation of our grant opportunities, as well as how our research that is funded through these grant opportunities translate to the priorities that MRFF has set. I would direct you to the financial assistance report, which is the most recent copy of this evaluation for your information.
Thank you, Leon. Catherine,
I think the other thing that's important from an evaluation perspective is there's also mapping to how we are addressing the areas of priority and strategic objectives as part of the design of the grant calls as well. So it really, and continually trying to make sure that we're doing better in terms of the impact of the work. Back to you, Bridget.
Thank you. So there's been a few questions on consideration of expressly including women's health as a priority.
Yes, and women's health is included as one of the priority populations. It's within that work. So again, as we're mapping and looking at specific calls, it's making sure that we're addressing those areas. So it is called out specifically.
Thank you. So we've had a couple of questions coming in looking at workforce and considering the workforce, not just the traditional health and medical research workforce, but looking at health economists and that broader space. Will the AMRAB be considering that sort of broader health workforce in the course of the strategy and priorities?
So yeah, so one, yes, and I think that it's an important note that went with that comment was the fact that such roles are not naturally supported very effectively in the NHMRC investigator program for various reasons. So we recognise the real importance of those roles in delivering translation, and one of the benefits of MRFF calls that pull together teams is that they need to be embedded in those teams for the grants to be competitive. So we need to make the requirement to delineate the roles they play and make sure they're funded very, central to our assessment of whether something's going to work or not.
I think the other thing that that I often use as the example of where the complementarity of the NHMRC and the Medical Research Future Fund are now talking to each other is that we have the potential to design schemes, and I think the investigator grant scheme really lends itself to then being able to not just fund the full pipeline of research, but to fund the full pipeline of investigators from basic and discovery science through to clinician researchers, but the real subspecialties that are essential in terms of that translation into practice. Health economists is a great example there, implementation science, health services research. So I think, to me, that's one of the things I'm most excited about, is that we can really go in with a plan to think about what is essential for us to achieve the goals from a workforce perspective. Hence, it's both a strategic objective and a priority. Bridget.
Thank you. There's been a question on international partnerships and collaboration. So there's not a specific mention in the strategy or priorities about international partners and collaboration. So just asking that, but also more broadly, asking you about partnerships and collaboration domestically and internationally. Has that been considered by AMRAB?
Ken, would you like to start?
Yeah, so domestically, clearly partnerships that bring value to an application for whatever funding call will be central to the success of those applications. So we expect partnerships to happen organically to drive quality science at a domestic level. Obviously, we can't fund overseas partners. And so I'm going to push back to Natasha, perhaps, how we deal with overseas collaborations, which have been very productive in the past, need to continue, but I'm not sure of the precise mechanism by which they're dealt with.
Yeah, no, I think I can take that, is that as part of the National Health and Medical Research Strategy, in terms of what we've identified as a priority within the MRFF strategy, is that importance of partnerships and looking at a system level. So we really want to see more, from a national perspective, more national networks that are addressing specific problems. But playing into that will be international partnerships and international collaborators that weren't, as Ken said, there's a difference between having those partnerships that are then funded, but I think there's opportunities, now that Australia is able to participate in Horizon EU funding. But what we usually find with our international partners is that they seek funding within their own countries as well. But we'll be really looking, I think, at all levels in terms of interventional benchmarking, but international collaboration, I think, is going to be very important. I think we're at time, Bridget.
We are at time. So on behalf of Natasha, who's having some technical difficulties, I'd like to thank Catherine and Ken for your generosity and your time today coming to speak on behalf of AMRAB. And I'd like to thank all participants. We would really encourage you, and we'll pop it back on the screen, the survey link. We'd really encourage you to provide that feedback either as an individual or as an organisation. And please be frank and fearless with your advice to AMRAB. Your information really informs the strategy and priorities. Thank you all.
And thanks, everyone. There was a question to see if the slides would be available. I'm sure they could be made available.
Thank you.
Thanks.
Great. Thanks, everyone. Have a good day.